Delaying surgery for patients with traumatic brain injuries of all severities should strongly be considered according to a new study entitled Clinical Outcomes After Traumatic Brain Injury and Exposure to Extracranial Surgery, and an accompanying editorial recently published online in the JAMA Surgery Journal. Surgery with anesthesia shortly after a traumatic brain injury, a TBI, is associated with poorer functional and cognitive outcomes according to the research, part of the continued TRACK TBI studies. Patients with TBI had worse functional recovery and poorer neurocognitive outcomes, including impaired executive functioning across all TBI severities at 2 weeks and 6 months compared with their counterparts who did not undergo surgery. TRACK TBI is a national multi-center study tracking traumatic brain injury survivors in 18 centers throughout the United States. It is the largest continuing study of traumatic brain injury, and their reports and recommendations justify our attention. According to the study authors, these findings support the hypothesis that surgery and anesthesia might need to be included in the list of secondary insults to be avoided to protect the brain after a TBI. Many individuals will undergo non-urgent surgery within 1 week after suffering a traumatic brain injury. The article cites research from a Mayo Clinic study which found that approximately 50% of patients with what was considered a mild TBI had surgery within 1 week of injury, and 5% had procedures and anesthesias unrelated to the traumatic brain event that caused their TBI. Based upon these studies, there are millions of patients worldwide who undergo procedures after a TBI that could likely be delayed yearly. Research regarding anesthetic risk, the mechanism of injury, and ways to mitigate this risk is essential to improving outcomes. Informed decision-making must be given to TBI patients, and serious consideration by patients must take place to delaying non-urgent surgery to improve outcomes following a TBI. Thanks for joining me this week, and I look forward to meeting with you again next week on a new edition of the Brain Injury Insider.